welcome to the Research Works podcast, live from the European Academy of Childhood Disability Conference 2024 in Bruges, Belgium. Join us for interviews with keynote speakers, world-renowned researchers and clinicians, and behind-the-scenes stories from one of the great paediatric conferences in the world.
Welcome back, everyone. Another wonderful episode here. I've got Sarah McIntyre from the University of Sydney and Cerebral Palsy Alliance and Gija Rackauskaite from Aarhus University, Denmark. How did I go? Oh, no, you're smiling. You can correct me. You want to say it again? I said it fine. Oh, okay. Fine. I did well. Welcome to the podcast.
Thank you. Thanks for having us.
Oh, it's so lovely to have both of you here, and to do this in person is always really, really lovely. And we were just chatting about how great this conference has been already. It's such a full itinerary, and I get to have my own conference here in my own studio, so it's fabulous. So today we'll be talking about your poster, which was titled "The Development of a Causal Diagram for Cerebral Palsy: A Study Protocol for Worldwide Multidisciplinary Collaboration." Now, before we get into the nuts and bolts of this, Sarah, please give me a bit of an overview about what this poster is all about.
Sure, thanks, Dana. So causal pathways to cerebral palsy, and that's the causes, etiology, is very complex. And there hasn't actually been a unifying picture, like literally a diagram, of what causes cerebral palsy ever.
Yeah, wow.
With all the causal pathways. and that's because it's very complex.
Yes.
But there's now new techniques that we can use called DAGs, which we'll get into.
Great.
Yes, that's such a good name.
Great name.
Yeah. I'm in as soon as it's a DAG. And so we're trying to illustrate all the causal pathways to cerebral palsy in one picture.
Wow. I mean, everyone loves a good visual, and I think it's so important. But tell me a little bit about why you felt to go down this path. I mean, I in my mind, I go, it helps a lot of people, but there would have been a whole journey to come into this place. Yeah.
You can either write a whole book about it, or you can and there will be a lot of tables in this book, and they will be difficult to understand for people who are not in the field. And these books will only be read by the ones who are interested in topics. And they will get old in 5 years because there will be new research. So that's why we decided to do something more interactive. We hope that will be interactive at some time point.
Yes.
And this is another way of showing the data. It's not just stable. It's dots, and then there is an arrow, goes to the next dot, and then there is an arrow that goes to the next dot, and then you can pull as many dots as you want. And everything ends with a cerebral palsy. And that makes it much more easier to understand and maybe show to the family this was the pathway for your child. Because most of the families, they think that's only one particular reason. That was the reason for the cerebral palsy. But in many cases, is my experience as a clinician, there are multifactorial reasons. So taking the blame from the families by this picture showing how many factors have influenced that your child has this disability, I think it could be a good tool to use.
That is fantastic.
That's why I get involved in this project.
Yeah. That's such a beautiful way of describing it, because you are absolutely correct in that, books and tables, and they are useful for a group of people for sure, but they need to be updated. But when you're talking with a person in front of you, a family that wants an answer, flipping through a book to show them where things are at isn't particularly sensitive to where they are at the moment, nor is it a tangible way to explain something.
It's also useful for researchers and for clinicians, because not only do families often think there's only really one cause,
True point.
But actually a lot of health professionals and clinicians don't understand the full complexity of the etiology of cerebral palsy. So we think it's going to be a knowledge-sharing tool for lots of people.
Yes. That's wonderful.
Across the whole spectrum.
So before we get into where this is up to at the moment, let's talk a little bit about causal pathways. And I know that that's an area of interest for, I've known Sarah for a little while now in terms of what you've done, but likewise for you, Gija. Let's talk about some of those causal pathways and maybe some examples of some of the complexities that are associated with that.
Yeah, sure.
Yeah.
So one of the causes that everyone straight away thinks about is birth asphyxia and hypoxic ischemic encephalopathy. So HIE is one thing, but not a lot of people think it's just what happens there at birth.
Yeah.
But by mapping out causal pathways, you can often see that there's a lot of risk factors leading up to that. Some will be just one thing straight away, that like in labour.
Yes.
But for others, there'll be many other risk factors along other causal pathways that led to this point in time.
Yes.
And so it expands that causal pathway quite a bit.
Right.
Prematurity is another example of a big causal pathway, but by doing what we're doing, we really try and map out all the different ways to prematurity and then the different responses from prematurity, how to eventually have a brain damaging event.
Wow. So would that information, and by understanding the different components or the pathway that led to that, help you to understand, I guess, the presentation as well? Because are you now looking at different causes, different parts of the brain that are affected? Is that what we'll be able to tell from this too?
Yes, you can to make it much more easier to understand. You can divide the causes in the ones like genetic ones that occurred in the way the child was created, and then there are some things that happens during pregnancy. Mother get urinary tract infection, and that is infection that's spreading to the fetus.
Yes.
And that can just pass by and the child is born on time. And another child will be born prematurely because of this infection.
Sure.
But the pattern of the brain damage will be the same.
Yeah, okay.
And some of the mothers, they do record back to this urinary tract infection if you ask them. And if that, like, immediately after that, the birth happens, everybody thinks was the reason.
Right.
But if that was 2-3 months before the labor, you will not think about it.
Yeah.
At least somebody ask you about it.
Yes.
And that, that makes some of the causes preventable, treating these infections effectively and taking this woman complaining about symptoms seriously.
Wow.
That could be one of the good examples where some children are more susceptible. A lot of women, I don't want women get worried about urinary tract infection during pregnancy, because most of the babies, they manage that very well.
Yeah.
But some do not, and we don't know why.
Yeah.
So this leads to that research question, that why some of the babies are more or women or are more susceptible for this.
You can really see how this is going to fill a big gap in bringing together knowledge we know, but also just there'll probably be new discoveries from this in itself. But as we're putting this together, I can imagine that being the case. So talk us through a little bit of the methodology, because my mind boggles when I think about how much information you're going to put onto the one page and how it's going to link.
It's a very busy diagram.
Yeah, and I don't imagine, I haven't seen anything like this before. So how do you even start to do this?
Yes. Well, the way we started, a group of us came together. We'd been talking about causal DAGs. This is a directed acyclic graph, DAG, which means that the arrows are literally going one direction. They can't come back. You've just got to have arrows that go towards a cause.
Okay.
That's the directed part, and then the acyclic part is that they don't come back on each other. So you're identifying causes.
I see. Yeah.
And so Gija had done some work in this methodology, and we were keen to start in this methodology. And then we had it was one of those wonderful moments where it was my first day back from summer holidays. I thought, wow, I'm going to have so many emails to get through. But the first email I got was from our collaborators in the US, who I didn't know before. And they also had the same idea about doing this whole DAG for CP, but they had the methodology knowledge, and they wanted us to come on board for the knowledge of the actual risk factors and causal pathways. So it was a marriage, made in heaven.
Absolutely, yes.
And I was like, these guys, one of them hilariously is from NASA That's a bit of a fun point. Yeah. And so
That's cool to say.
first day back, first email, collaboration with NASA.
Yeah.
This is a
This
good
is
day.
not a joke. It's
No,
true.
that's-
I love that.
Yeah.
So great.
And
They work in this very good meta. We really like that collaboration. They are effective.
Yeah.
so we
How
set up a team
wonderful. Yeah.
who worked in this area. And we just kept it small. There's about 10 of us, just 8 to 10 of us to start with. And we used our knowledge plus the literature, of course. Well, our knowledge comes from the literature, of course. And we did monthly meetings for about a year where we were putting this together.
Yeah.
And then in between those monthly meetings, we did a lot of work bringing the literature in.
Yes.
And so we started plotting pathways from the pre-pregnancy period. We started with variables in the pre-pregnancy period, moved across to the perinatal period, and then neonatal period, and then started doing all the linkings along the way. So
How
it's
long
been
is that process? I mean, is it finished?
No, we're calling it a draft.
Great.
Because at the moment, what we're doing here and what we're doing at other conferences and with other groups is getting feedback on
Beautiful.
the very first draft.
Wow.
So we did a workshop at the American Academy last year.
Yep.
Gija and Kate Himmelman ran a workshop with SCPE. We're here to get feedback from Europe. We'll have a workshop at Oz Academy. And we're also having a workshop with colleagues in low and middle income countries in the next month and making sure that's all well incorporated as well. And the idea is after those workshops, we'll call that version 1.
Version 1.
Yeah.
Wow.
Yeah.
So in terms of a time period, just to give people an idea, I suppose, from the NASA email.
Yeah, January last year, not this year, last year. Yes.
Last year.
So it's
That's
taken us.
actually pretty speedy.
Yeah,
I think that's pretty good to
we
get
got on with
busy.
it, didn't we?
Busy people internationally to be on the same topic, to work on that, whilst this is not the only project you're working on, right? So
Definitely not.
that is impressive. And to really be engaging with so many different stakeholders. I mean, I feel like I've been saying this a lot, but maybe this is the true symphony. Maybe you guys are the ones that started the symphony in the first place.
Well, I did forget to say that also we've engaged with families as well.
Of course,
we have a group called CP Quests.
Yes.
And I sent out a expression of interest for CP Quests, and we had 4 mums put up their hand, like literally in the first 20 minutes after I sent the request. And they all had children who were in their 20s, which I found really interesting.
Yeah.
And they are still fascinated and really still wanting to understand the etiology of what caused the CP for their children. So this is something that doesn't stop for families. And so they've also given us feedback. And
That's amazing.
they will be on the journey with us all the way through as well.
And journey is the right word, isn't it? I think I'm so glad he touched on that point, because so many times, not that I think we intend to think that way, but you get your diagnosis, you kind of move on with it. We talk about let's be functional, let's participate, let's do all those things. Sometimes that happens amongst a lot of grieving. That can happen for many, many years, and actually understanding the diagnosis gives that closure or a pathway at least of understanding what's happened. And
well, some of these
really
mums
powerful.
actually they did use the word guilt 20 years later, that this felt like this would relieve the guilt for them. One mum, she did have a infection in pregnancy, and she's always worried that it was the stockings she was wearing.
Oh, no.
That were not breathable, and it made the infection. So that was a pretty interesting. This is 20 years later, and we're able to say not the stockings.
Yeah. These are powerful messages, and it's just so vital that we are having these kinds of conversations, these kind of collaborations. I guess what would be your hope here? I think we've kind of covered it a little bit, but I guess what would your hope be about this collaborative project and where you would like to see it go? Because I'm sure knowing
we have big hopes.
You've got big hopes. I can see that there's a direction headed here.
So we do have a direction. We want this to be a global project.
Yeah.
So almost like a crowd surfing thing. So, and we don't want to hold on to it. Like we're just drafting it.
Yeah.
And then we've got a plan of putting it possibly, we have to apply to them, on the EACD website so that we can, and we're trying to develop a system that people can put in feedback, and then we can incorporate the feedback through. We're developing all these systems.
Yes.
That people can take the code, they can put it in this software called Daggity, which is free. They can play with it themselves.
Dag. Oh my goodness, it's got all the best words.
That's the best of the software is for free. Everybody can use if you make an effort to learn it.
Yes,
it doesn't take that long to learn it.
But I was just being a course supervisor for a PhD student who was doing that job. So but other people can do that as well. So it's that when you have opportunity to things without you need to have a license or something like that. So it's for everyone.
Yeah.
And we'll have the code available for everyone, so everyone just whack it out, throw it in, and have a play.
Wow.
Yeah.
You know, this reminds me.
You need to find the way of the steering the process.
Yes.
That will be important.
Yes.
That it's like that is approved that this is the good knowledge, because there are also some knowledge that is not such a good quality.
You need to protect them as well.
That's right. As well.
Yeah. It's not just open for all in that way.
And then the other thing to note is that this is high level. Even though there's 90 nodes on there already, it is still high level. So the other thing we're looking at is groups who have specific interests, say in infectious diseases, to take that pathway at the high level and then develop up another DAG at a much more specific level.
Wow.
And then that goes on the site as well, so that the DAGs are a big overarching and then specific and in-depth.
Wow. And so you can see how this will evolve with more knowledge and you know, it's not going to take us that long to disseminate all this information all the time. It almost reminds me a little bit of I think computer people, and you know, producer Ed's probably taught me a thing or two about codes, but you know, open source. They talk about open source and the whole idea that people can all input together, and you know, you can't go in there and break the code, but you're constantly adding to it. You're inviting people with like minds to invest into the space too. Gosh, it's amazing, and you guys are doing it. Thank you so very much for spending the time to, number one, to do this in the first place, number two, to talk to us about this, and we'll definitely stay in touch with you as this evolves and make sure that everyone knows where it is and how to access it.
Yeah, thank you.
Thank you very much. And to all of our listeners, I hope you really enjoyed that as well. Dag and diggity dog. There's lots of terms out there, but gosh, this is going to be really life-changing. So stay tuned for more episodes, and I'll talk to you all again really soon. Bye.
Bye.
Bye.